Good day, everyone. My name is Ilse Boysen, and I'm a social worker at Stabilis Treatment Center. Thank you for watching. Today, I would like to talk to you about mental health and sobriety and recovery as well. I think this time of the year, it is very relevant to experience an emotional imbalance somehow, because the year has been long. Everyone is quite tired. You will also find that your emotional capacity is quite low. Your emotional tolerance is low. And often what I experience in the support group that I facilitate is that the patients start, or the clients start, making small compromises, such as, I know I'm not supposed to drink non-alcoholic beverages, like the 0% beer, whatever. I don't want to mention any brands now, but I think I deserve it. So the defense mechanisms start kicking in, rationalizing, minimalizing why they should do it. And I really see and find in the survivor group, which is the support group of Stabilis, that the patients, some of them are making small compromises. As I've mentioned before, I do believe that emotional sobriety is the most important when it comes to sobriety, because physical sobriety can be obtained, through a detox, coming to a rehab, going to a hospital, going through a detox. But the emotional sobriety is the sustainable part that is so important, and it is such an integral part, of sobriety. And that is why I would like to speak to you today about mental health and making sure that you know where you are at with your mental health. So if you are a family member of someone in recovery, or if you are an individual who's in recovery, I want you to listen carefully. I think, first of all, you need to ask yourself, and this is something that you can journal about, this is something that you can use just to self-reflect and become self-aware, is to ask, on a scale of 1 to 10, how is my mental health? 1 obviously meaning or implying that, you're in a very bad space. And then if that is the case, to assess and ask yourself, for how long have I been in this space? If it's 2 days or 1 day, it's completely normal. But if it's 5 days or more, even 3 days or more, it's a cause for concern. So it means you have to do something about it. And doing something about it is, asking yourself, when last have I gone to a support group? Am I taking my medication? What is my lifestyle looking like? Should I go for psychotherapy sessions again? If it's a 5, it means it's neutral. We all go through our dips. Sometimes we just feel okay. And if it's a 10, it means you are in a really good space, which is fine. Another thing to be very cognizant of when it comes to your mental health is to ask yourself, when last have I taken time out? And time out, I always say, means something different to everyone. So time out could be, disengaging from social media. Time out could be taking a leave day from work. Time out could be connecting with nature. Time out means, what can I, or what have I this year, what have I put in place, to refuel myself and also then refuel my sobriety. Because sometimes we need to just, disconnect from the world and connect with things that's important to us for a small period of time, if that makes sense. The last question that I think is very important to ask yourself is, when last have I asked for help? And this is very important because we often, we're often there for other people. I often hear clients say, maybe I was admitted at rehab, to be there for someone else and to help them through the journey. Or now that I've completed my treatment program, I can go and change the world. And that is great. There's nothing wrong with that. But you can't pour from an empty cup. You need to fill yourself first before you can be there for other people. So it's important to ask yourself, when last have I asked for help? That would mean leaning in for support. That would mean if you are struggling or you just need a sounding board, that you have your team or your people that you can speak to and reach out and say, you know, I don't know what to do in this situation, or I'm really struggling, or I know you've gone through the same thing, or you have knowledge about it, so what helped for you. And I think, you know, I'm bringing up this topic and I'm talking about it because I think this time of the year, everything just goes out the window. You know, we're just pushing and we want to head towards the end of the year and we just want to relax. But we forget that sobriety is a lifelong process. The work does not stop. And I mean, we shouldn't regard checking in with your mental health as work. It's a priority. It should be like that. And in the same way that we often visit our medical practitioners, we service our cars, we maintain our houses and our gardens, you know, we have to service and maintain our mental health. Because if you are doing sobriety and you've been in recovery for 3 years or 4 years, and it's not going well with your mental health, it will definitely have a ripple effect on the other aspects of your life. I hope this makes sense to you. I hope these 3 nuggets or key points that I've pointed out is something that you can reflect on. And even if you just watch this video and you don't know of anyone who's been addicted to a substance, or you yourself have not been in that situation, you can still use this prompts, I want to say, to use it in your life and just check in with your mental health. Thank you so much for watching this video. Please remember to like, subscribe, and if you have a comment, please feel free to join the conversation. Have a good day. Bye.